Hello, today you're very welcome to my presentation on an exploratory study regarding the effectiveness and experiences of personal education plans for children in care in Northern Ireland. My name is Patricia Nicholl. I'm currently a third-year doctorate student in childhood studies at Queen's University, Belfast. This study takes a children's rights-based approach, considering the United Nations Convention on the Rights of the Child, 1989, and the fact that all children have rights, but with a particular focus on Articles 28 and 29, the right to education. The background to the study is predicated on a raft of overwhelming national and international evidence about the poorer outcomes, educational outcomes for children in care in comparison to their peers. In 2017-18, 76% of children in care attained 5 or more GCSEs at grades A to G, and this compared to 99% of the general school population. 54% attained 5 or more A star to C or equivalent GCSEs, compared to 86% of their peers. 79% at Key Stage 1 attained Level 2 English, compared to 87% of the general school population. This was similar in terms of attainment levels for Level 2 Maths, with 79% of children in care attaining Level 2 in comparison to 88% of the general population. Significant differences in educational attainment emerge at Key Stage 3, where this situation appears to become somewhat exacerbated. The Department of Health in 2018 published statistics identifying the fact that 36% of Key Stage 3 children who are in state care attained Level 4 English, compared with 71% of the general school population. 39% of children in care attained Level 5 Maths, compared with 73% of their peers. The conceptual framework for the study takes its focus from those universal children's education rights and juxtaposes those against current social welfare and education policy, which has seen a significant shift in state responsibility and the growth of managerial and bureaucratic practices within both health and social care and the education sector, with a focus on performativity and a more individualized, risk-based approach to children's social care needs and educational attainment. And so it really starts to look at this from the point of view of both the child as the individual, taking account of some of those factors within the lives of children in care, many of whom have been significantly traumatized and have experienced disruptions in early attachment, and some of our understandings of the stigma and the labelling of being in care and what that means around the social exclusion of children in care within the educational sector. And so it was an attempt to try to look at the educational attainment of children in care in two particular ways. One was about considering the voice of the child experiencing their early education in primary school years, and trying to develop a participative research framework in order to augment the voice of the child, not just in terms of the participants in the research, but also in informing the methodology of the research through a children's rights-based framework. It was also important for me in this study, as part of that conceptual framework, to consider the role of the corporate parent, those educationalists and social work staff who are responsible for promoting the educational rights of children, to consider the evidence of what has worked in terms of multi-agency collaboration in terms of the implementation of endeavours to change and improve the educational attainment of children in care over the last number of years. And for this reason, as I go on to state in terms of the methodology, it was really looking at current educational and social care policy as evidenced by the personal educational plan, and to try to understand from a practice perspective and an evidence-based perspective what currently is working, how effective are the current personal education plans, which were put in place in 2000 in England and in 2011, later updated in 2017 in Northern Ireland, to understand from those protagonists, those individual children and professionals working within those personal education planning processes, how is it working? Is it working? What evidence is there for its effectiveness? And more importantly, to understand from the contributions of those key players what might work, how a more children's rights based approach to personal education planning might improve the outcomes for this policy and process, and ultimately augment the educational attainment of children in care. The study therefore aims to explore the effectiveness of current legislation, policy and practice regarding personal education plans, and to explore the views and experiences of professionals and children in care of personal education planning processes. The study is a qualitative study. It is therefore predicated on an interpretive approach regarding the perceptions of those individuals in the real world as important and enabling a rich understanding of research phenomena. It is predicated on our understanding around epistemological constructivism, around the nature of our knowledge and how that is formed and created by human interaction and an understanding within a social construction in accordance with Bettis and Gregson 2001. As it stands, the study currently has 3 objectives, one of which is to assess the effectiveness of current policy, procedure and processes associated with personal education plans, then to explore the views and experiences of those professionals and hopefully the children in care themselves regarding personal education plans, and thirdly to evaluate whether the development of a more child rights attuned personal education planning framework could help enhance interprofessional practice and the educational outcomes for children in care. I've already talked about the methodology being underpinned by a children's rights-based approach, and the first and core element of this was the development of a children's research advisory group. This has involved the recruitment of a small number of 6 primary school children who have engaged with me in order to think about the research questions and to advise me on the best way to talk to primary school children who are in care about their education, and to have helped me to consider the nature of the data collection instruments and to actually think about issues such as data collection and the dissemination of the findings of the research. And at this moment in time, the research advisory group has been completed, and the data collection instruments have all been refined and retuned to take account of some really, really rich comments from the children. The methodology then is a qualitative methodology involving the creation of a series of semi-structured interviews or focus groups to elicit the voices of children in care about their experiences of personal education planning processes. Alongside of this, it is planned to establish a series of semi-structured interviews or focus groups with key professionals of teachers and social workers who are charged with promoting the educational attainment of children in care, and more particularly who have key roles in the personal education planning process. The final aspect of the methodology entails a series of semi-structured interviews or focus groups with key stakeholders, those individuals in the social care and education sector who have a policy, inspectorate or quality assurance remit for the education of children in care. And it is planned that those interviews will also serve to inform the findings of this study. The CRAG meeting, Children's Research Advisory Group, met on the 11th of March of 2020, and that meeting was designed to enable primary school children to contribute their views and perspectives on the methodology and approach designed to conduct the study. And I was really gratified that all 6 of the Children's Research Advisory Group contributed so well to the study and endorsed the use of the 3 puppets, Rory the dinosaur and his supporting friends Fiona and Ellie, as a good means of engaging children at primary school key stages 1 and 2 in discussions about their educational experience and their experiences of the personal education planning process. The children all felt that these puppets were engaging and relatable, and felt that they were an excellent way in which to elicit the views of the children in an abstract way in discussion about Rory's education being supported by his good friends Ellie and Fiona, rather than focusing on their own or on specific children's educational needs or experiences. That said, the children were able to provide a tremendous richness of information and perspective on the language used, the photographs and pictures used, the detail involved, the explanations required in relation to a range of the study basic information pro forma, such as the participant information sheets and the participant consent forms. All of their comments were taken on board, and the participant information sheets and consent forms were amended on the back of the comments of these children. More importantly, the children provided a wealth of information about the appropriate means of engaging the children participating in the study to help them to feel relaxed, to help them to understand the nature of the study, and more importantly to consider the best activities which might ensure maximum participation from the children and reduce any boredom factor or any lack of interest, as energies might waver throughout the focus group or semi-structured interview. The children provided a wealth of information in relation to particularly the use of sensory equipment and toys, which I was using during the Children's Research Advisory Group purely by accident and serendipity, as we were using a sensory room within a local primary school. For this reason, I plan to take on board the children's views and actually utilise some of these toys and tools within my study with children in care. All of the children provided endorsement of the fact that the findings of the study should be widely disseminated, in particular should be widely disseminated with children in care and across that sector. And these views have contributed to the strategy and plan for dissemination of the findings of the study. Plan next steps in relation to the study. Obviously, the planning and preparation stage is by and large completed, with the transcripts of the Children's Research Advisory Group having been completed, and the amendments of the relevant pro forma having been made further to their advice and guidance. Stage 2 is well underway in terms of the literature review in respect of the study, and the search strategy is being completed and the literature review is well underway. The data collection instruments have now been firmly developed further to the input of the Children's Research Advisory Group, and the study simply awaits submission for ethical approval. That said, it's important to consider the likely impact of the COVID-19 pandemic on the data collection phase of this study, and I'll go on to talk about that in a later slide. The next stage really is a timetabling, which during the incoming year I would plan to have activity-based focus group or semi-structured interview with children in care, followed by an interview schedule with or focus groups with the professional teachers and social workers and key policymakers. These I would hope would all be completed from September through to June of 2021, and will culminate in the write-up of a set of findings inclusive of descriptive statistics and qualitative thematic description of the findings of the study, which will provide recommendations for policy and service improvement. Just to say a wee bit about the findings of this study, clearly the Children's Research Advisory Group participation will be outlined in the findings and how they contributed to these findings in terms of their views and contribution. The interviews or focus groups will all be recorded and the data transcribed, and a range of themes will be extrapolated from this data, which will then be coded and analysed and conclusions drawn. A report will then be drafted, which will provide recommendations for policy and practice transformation in respect of the personal education planning process within Northern Ireland, in order to ensure that this process becomes a process fit for purpose, rather than regarded as being inadequate, that it is regarded as best practice. Okay, at this stage it serves me to review the study in light of the potential barriers and the COVID-19 implications. At this stage, there are significant delays in relation to the ethical approval application in respect of the study, and essentially the COVID-19 pandemic has introduced potentially further delays in relation to my methodology, which may require that to be further refined and reviewed. Data collection is most likely going to be further impeded as health and social care trust service delivery priorities have shifted during the pandemic. This will impact on my potential capacity to gather information and data from focus groups and interviews, not least because of the workload capacity for social workers to both identify and support the information and consent seeking measures involved in the study, but also the actual data collection process itself will be impacted upon by the social distancing measures and movement restrictions going forward. Access to social work staff and children in care will be impeded, and it may become increasingly difficult to access teachers and children in care during the period of school closure, and even during the early stages of reopening. So all of this will have significant impact on my timescales for delivery of the doctorate and the design and methodology of this study. Well, that concludes my presentation. And I thank you for taking the time to view the presentation and to consider some of the issues that I have outlined. This is a project about which I have great passion, having spent a large number of my career years in practice in children and family services with particular focus on children care. I would hope that you will make contact with me at pnicholl03.qub.ac.uk should you have any queries or questions or wish to discuss the project further. Thank you very much for your interest.